Will the Committee of Supply please come to order? This section of Committee of Supply will now consider the estimates of the Department of Families. Does the Honourable Minister have an opening statement? The Honourable Minister of Families.
Thank you very much. I'm very pleased to be here in Committee of Supply for the Department of Families. It is a real honor to lead this department. And before I get into some of the highlights of the department's initiatives, I do just want to say thank you so much to the staff, many of whom you'll meet as we go throughout the process, many of whom are here today. But to really emphasize and stress the gratitude that I feel for their initiatives each and every day. It is arguably one of the tougher departments in government. We're dealing with very vulnerable individuals and families and working under extreme pressure at times. And yet each and every time, department staff have always risen to the task at hand, whether it is trying to find housing for people who are out of their community because of a forest fire or a flood or are fleeing their war-ravaged country, whether it is finding supports for women and children who are fleeing domestic violence, whether it is trying to support people who are able-bodied in very unique and special ways, whether it is trying to find housing for people under complex circumstances or supporting children in care and trying to help them reunify with their families. These are, none of these are easy challenges, and the Department of Families rises every time to continue to serve the people of Manitoba, and I am eternally grateful for their service and their support. I do want to highlight a few of the things that our department has undertaken in the last year. I won't be able to get to it all in the time that is allotted to me, but I do want to highlight and go right to some of the supports that we've done for persons with disabilities this year, as I know that that is an area that opposition has indicated they would like to hear from today. And so I just want to put on the record that Budget 22 provides an additional $26.4 million for the Community Living Disability Services Program that our government was very pleased to announce earlier this year. And at that time, we had many advocates in the disability community express their appreciation, and one of them said that it was the largest infusion of cash into the disability sector in over 20 years. So these funds will ensure that adults with an intellectual disability will continue to be supported to pursue the goals they have identified through individualized planning, including skills development to foster greater independence, employment and job training, and engaging in social activities in the community. Budget 22 also provides $16.4 million to new participants to access the community living disability services, as we understand the importance of supporting our service providers to recruit and retain highly skilled frontline workers in the adult disability services sector. To ensure that safe and reliable service continues to be provided, we took steps to stabilize this important workforce with a $10 million initiative to increase wages paid to frontline staff employed by our service provider partners across the province. These new investments build upon the projects that our government committed to supporting in 2021. In December, the Vulnerable Persons Living with a Mental Disability Task Force completed a very comprehensive review of services for adults with intellectual disabilities. The task force final report is called The Pathways to Dignity: The Rights, Safeguards, Planning, and Decision Making. And it explored issues related to services to adults with intellectual disabilities and made recommendations in 16 key areas. Our government is committed to implementing these recommendations and release a 2-year implementation plan to support this important work. I do want to thank everybody who was on that task force, including the chair of that task force, who was none other than Dale Kendall, who was very instrumental 25 years ago in bringing about the legislation to support vulnerable persons. And so it was very sentimental to have him full circle come around and lead the 25-year review. As a first steps towards implementing some of the recommendations, our government provided $775,000 for 2 important pilot projects. to support and develop independence for adults with an intellectual disability. For that first project, we provided $100,000 to Inclusion Winnipeg to deliver person-centered training in the disability support sector across Manitoba, including direct service workers and agencies and community service workers in the department. The second project, we provided $675,000 to the 120 Maryland Group, a collaboration of 5 prominent disability services and advocacy organizations in Manitoba, to develop peer support networks for families over 2 years to promote the use of community-based assisted decision-making. Our government had also launched a 2-year pilot project that will provide long-term out-of-home respite care for families who require more comprehensive support but do not wish to place their children into the care of Child and Family Services. I remember saying at the time that nothing could be more heartbreaking than a family needing to assign care of their child over to CFS so that they could receive the supports that they needed, which is what the historical system had left families feeling the need to do. And so this bridge program is a way to allow families to stay together and provide some of those longer term respite initiatives with an $8 million investment in keeping families together and providing support for those children and youth with complex disabilities. We also announced a $4.8 million out-of-home respite project to continue supporting the needs of families caring for children with complex needs. As a minister responsible for accessibility, I'm pleased to also provide an update on the implementation of the Accessibility for Manitobans Act, which calls on organizations to identify, remove, and prevent barriers that affect nearly 1 in 4 Manitobans with disabilities. As you're likely aware, we've enacted 3 accessibility standards for customer service, employment, and information and communications, which were developed with the assistance from stakeholders representing businesses, municipalities, and the disability community. The Accessible Customer Service Standard has been in place since 2015, and we just completed the 5-year review on that. The 3rd standard for accessible information and communication just came into force on May the 1st of 2022, and it primarily removes barriers to content and interactions that are accessed electronically, particularly through websites. As with our other standards, the department will provide policy handbooks, templates, and webinar presentations for free at accessibilitymb.ca to encourage compliance from all impacted businesses and stakeholders. Standards respecting accessible transportation and the design of public spaces are being developed, and we anticipate their enactment in 2023. Stakeholders wishing to comply with accessibility standards often need financial assistance, and in response to that, our government had created the Manitoba Accessibility Fund to provide annual sustainable grants for initiatives to promote the principles of accessibility. We thank the Winnipeg Foundation for hosting the $20 million endowment with an annual working capital that will initially average $775,000 a year. I was very pleased earlier this year to host the very first award ceremony where 30 successful organizations received grants from that Manitoba Accessibility Fund that was very much needed and supported for nonprofits, organizations, and municipalities to receive funding to upgrade their businesses and their service offerings so that there would be no barriers, that all Manitobans could access them. And so those are just a few of the highlights in regards to disability services that we are providing. And I'll just conclude my my opening statement with work that is ongoing right now, and that is the creation of the new disability income support program, where we are in the process of moving all of our EIA clients who have severe and prolonged disabilities into this new disability income support program, so that they will no longer need to continuously go back to their service worker and confirm that they have a disability in order to receive that benefit. And we think that it is very positive that the Disability Support Act and received royal assent, and that these initiatives are underway, and we certainly look forward to having this transition of clients on this new income support program. So with that, Mr. Deputy Speaker, I know I only covered one small area of my department, but I'm certain we will touch on the other very important initiatives in housing, EIA transformation, and child welfare transformation in further questions.
We thank the minister for those comments. Does the critic from the official opposition have an opening statement? The member for Point Douglas.
Miigwech. So thank you to the minister for that. I appreciate, the work that you do, because I know that a lot of the work that you do is something that you're very passionate about, you've been through, and certainly have experience with, and I know you know your files. So I just want to put a few words on the record just in regard to, some of the things that we're seeing right now in our city, in our province, in terms of like housing. We see a lot of social housing boarded up, including the social housing that I used to live in, which is number 4, 711 Dufferin. There's like 4 units out of 10 that are boarded up, and we have a homelessness issue here in our province, which, is putting women at risk. And we certainly seen in the last week, a homeless woman be burned to death. And, we don't want to see those types of things happening. And we're hoping that, we're going to ask some questions about that and what is the province doing to make sure that those units are getting fixed so that families can be in them. And as well as we're hearing on the doorsteps, people are moving out of social housing because they're riddled with bed bugs, they're riddled with cockroaches, they're being overrun by people that are not occupants of the apartment buildings, which has made it unsafe for whether it's seniors or young families or the everyday Manitoban. And rents are really expensive in Manitoba, and people have no alternative but to live in social and affordable housing. We haven't seen any new units built, so that's another question we'll be asking about and talking about a strategy, whether this government is planning to ensure that we're building housing to meet the needs of Manitobans. We know that there was another shelter opened on Sutherland, or not on Sutherland, on Hagen, Disraeli, 190 Disraeli. And that has met some of the need, but it's certainly not a sustainable need. We need to be building more social housing and not building more shelters. And certainly we've heard from women that are in these shelters that they feel unsafe, that there's no space for them. And we see people all over this province, carting around their belongings in a shopping cart, which is, not humane for them. It doesn't give them any dignity, and we've all seen it. We're coming to winter, and I know as we walk out of this building, the Manitoba Legislature, there is always people in both of these bus shelters. And as the cold weather's coming, we need to really have a plan. So I'm looking to, this government to ensure that we don't have people that are sleeping in these bus shelters, that they have an alternative, and especially our women, so that they're not being exploited. And we know that there's families as well that are now becoming homeless because they can't afford the rents. They can't afford the increase in food. They can't afford the increase in hydro. And it's forcing people to couch surf. People aren't on leases, so they're getting warnings about, vacating, and they have nowhere to go. There's no shelters for families unless someone has been a victim of domestic violence, and that needs to change. So certainly we need to be looking at what are we doing around housing. Another issue that I've heard from a lot of agencies is the block funding or the basket funding that they receive, that they're being underfunded and they're not able to serve the needs of all the families that need to be served. We've certainly heard from families who have opened their doors and taken in their family members, many of whom, are working 2 jobs just to support their own family and are expected to, care for 1, 2, 5 children without getting any support from the government. So we think this is the wrong approach that we should be supporting. We know that they're given health care for the first 6 months, and often these families, maybe working in precarious jobs where they don't have health care, which leaves children not able to access dentistry, not able to get, access to optometrists, like things like that. So, and it's putting children at risk. There is so many children that are in need of mental health supports. That's another area that agencies have been talking to us about, that they don't have the funding to be able to provide these supports, whether it's a psychologist or a clinician, that the dollars aren't there to support these kids. The other thing is, I know Bill C-92 is coming in, and we're starting to see communities take on that work like Peguis, but we need to ensure that the supports are there, and we're working collaboratively to ensure that that handoff is not just a here you go, but how do we make sure that all of those children's needs are met, and that the things are in place that need to be in place for those children. Daycare, we've certainly heard from, and I know the minister has probably heard from daycare providers, that they were given the subsidies and expected to disperse them. They didn't have the staffing to be able to do that. Every single person who applied for subsidy or didn't, whether they were in need of it, were given it, which is an unfair practice, because if I make $100,000, I have one child, and I apply for the subsidy because I'm told to apply for the subsidy, I automatically receive that subsidy, which takes away from families who actually need the subsidy. So, I know that subsidy's come to an end now. There was 3 months of it, but then now families are left with, how do I pay, for my daycare fees when everything else has gone up? And 3 months was great, but there needs to be a longer term solution to that, and ensuring that the people who need the subsidies get the subsidies. Disabilities, we've heard from a number of folks, and certainly the Disability Support Act has put folks in precarious positions where if they're diabetic and they have a special diet, they've been cut off from that diet. We've written letters to the minister in regards to some of these cases. Doctors have written support letters to say that these folks need long-term access to disability, and that it's a lifelong struggle for them, and that they require special diets. But yet these folks have still not been able to access. So we will be asking a lot of questions around that. OFE is another area, and we recognize that people need to gain skills to get into the workforce. This is a Band-Aid solution. We need longer term access to training programs for folks. I know a number of my family have gone through the OFE program, and it's basically they come in, they are put on a computer, and they're looking for a job, whether they have skills or not. And that creates a revolving door for a lot of folks, because they get into a position where they're not qualified, and they end up not being able to continue that job because they don't have the ability to, and there's no option for them but to go back on EIA, which means they have to apply, and it takes about 6 weeks for people to get on EIA. You have to call, make an appointment, someone calls you back, and that's another area. If you don't even have a phone, or you don't even have a home, you're going to sit at the shelter and waiting for a phone call, because that's the only place that the number you can give. So it's certainly put a lot of strain on folks that are seeking shelter benefits to get out of these shelters, but also to get the skills that they need to get out of what we call the welfare wall. So longer term programs that actually support people to get into the workforce, and making sure that they have the skills to do the job. The other thing is, when they do get a job, or they are called for an interview, they aren't given any extra funds. And I know when I was on EIA and I was getting into the workforce, there was a fund that you could apply to for work clothes. And that's super important for people, especially if you're going into the construction industry. You have to have work boots. They're not going to allow you to come and work unless you have steel toe boots. I certainly would want to go to an interview in clothes that perhaps, I'm living in a shelter and I don't have access to, laundry every day, and I've been wearing these clothes for a few days. So certainly setting an example and making sure that people are able to get into these jobs with the skills that they need. And lastly, I just want to note that this portfolio is held by Danielle Adams, and as December comes, that we remember, our colleague that fortunately passed away on Highway 6, and she was very passionate about housing, daycare,
The member's
disability.
time has expired. Is there leave? Leave is granted. The honorable or the member for Point Douglas.
Yeah, and just that, we want to make sure that we're honoring her and continuing to do the work that she was so passionate about. And we look forward to working with the minister. And I know that the minister is very knowledgeable about the questions we'll be asking. So, miigwech.
We thank the member for those comments. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 9.1 bracket A contained in resolution 9.1. At this time, we invite the minister's staff to join us at the table, and we ask the minister to introduce the staff in attendance. The Honourable Minister of Families.
First of all, I'm very pleased that I have Deputy Minister Michelle Dubik in the Department of Families. She is not here today. She'll be joining us probably on subsequent meetings at Committee of Supply. I do have to my left Catherine Gates, who is the acting Deputy Minister, and she is also the Assistant Deputy Minister responsible for Community Services Delivery Division. I also have Heidi Werman, who is the Assistant Deputy Minister responsible for Corporate Services Division, and Brenda Fang, who is my Assistant Deputy Minister responsible for the Administration and Finance Division. And against the wall, we have Christina Moody, who's the Assistant Deputy Minister responsible for the Child and Youth Services Division. And we have Elizabeth Dubichka, who is the Assistant Deputy Minister of Child and Youth Services.
Indigenous governing bodies.
Indigenous governing bodies. My apologies. Elizabeth recently had a title change, but we have this newly created Assistant Deputy Minister position, and very pleased to have Elizabeth in that role. Joining us later will be Dwayne Reniak, who is the Acting Chief Executive Officer responsible for Manitoba Housing and Renewal Corporation.
Thank you, Minister, for those introductions, and welcome everybody. According to our Rule 77, bracket 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The member for Point Douglas.
Miigwech. The minister, as I understand it, has taken the existing disability program and divided it into three things. One, a new disability support program for those with a permanent disability lasting longer than a year. Two, a newly named medical barriers to full employment program. 3, those who might have a disability lasting less than a year. Can the minister take us through these 3 and give us a better understanding of how each of them will work?
The Honourable Minister of Families.
Thanks. I appreciate the question from the members opposite on the Disability Income Support Program. And our government was really pleased to pass this legislation last year and begin the work on creating this new program for people with disabilities. And the first category is the severe and prolonged disability category. These are for individuals who are anticipating having a disability that will last well into the future, that they are likely going to not have any changes in their physical well-being year over year. And so by moving them over to the severe and prolonged category, we're not only increasing their benefits, and those are spelled out in the regulations that we're consulting on right now. I believe we just undertook a 45-day consultation period that concluded just recently on what that income support program would look like in terms of the monetary amounts included in there. And I look forward to concluding that process and finalizing that category. And so these are people that will no longer need to go to a doctor and get that sort of medical note and then meet with their service provider and explain that they are still requiring the disability income support. We thought that it wasn't very dignified for people that have severe and prolonged disabilities to have to go to a doctor year over year and then confirm their disability with their worker year over year over year. So we received a lot of feedback from community when we were consulting on this legislation and on this initiative, and generally it was very well perceived. The second category is medical barriers to full employment, and these are people that are experiencing episodic disabilities and will not be able to engage in a work program and anticipate their impairment lasting up to a year or longer. And they will be in that category. And then the other category are people who do not have a full disability that is expected to last a year or more, and they will be eligible to continue receiving the regular EIA assistance, but yet they will have their work expectation deferred if it is required, and they will receive general supports through that program. I would like to just highlight that this year alone, or just recently, our government had increased the EIA basic rate for people in the general assistance category. This is a rate that hadn't been increased since 2004. And even at that, it had increased nominally since previous years. And I often think back to my own experiences when I was on EIA in 1989 and 1990, and the rate as it was set in 1990 and the rate that it was set up until we basically had provided this increase had only grown incrementally by a few dollars. And I think about what it would be like to have no increase in your annual household income since 1990, and what that has done to families. And we certainly do recognize that it has created significant challenges and struggles for people who are that have barriers to employment, who are not able to achieve independence, and who rely on the social safety net for their monthly income. And so the increase that we had provided that came into effect on October 1st was the first of its kind since October 1st. And we know that we still have many, many more steps to go to lifting people out of poverty. But placing it into context, I think all of us in this room can agree that if we hadn't received any income or any increases to our household income since 1990, we'd all be in a far worse position. And with those thoughts, I certainly look forward to future questions from the critic.
The member for Point Douglas.
I'm wondering if the minister can elaborate on the permanent disability, some examples of what a permanent disability would be, episodic disability would be, and then the third, like lasting less than a year.
The Honourable Minister of Families.
Thank you very much. Under the severe and prolonged disability category, for example, all of our CLDS clients will automatically be enrolled in the severe and prolonged disability category, as well as people with permanent intellectual disabilities, people who, for example, are receiving the CPP disability benefit, someone under the age of 65 that's living in a personal care home, they would be automatically enrolled in the program. Someone with a long-term disability that we know that a full recovery is been determined by a medical expert to likely not happen within the year or longer, such as a diagnosis of schizophrenia or another long-lasting impairment, they would be subject to the severe and prolonged disability category. And again, a lot of it will be subject to a doctor's assessment. The medical barriers to full employment would be, for example, undergoing a client who is undergoing medical treatment that is expected to last a year or longer, a long-term cancer treatment plan, that sort of thing would allow them to be in that category. And then in the short term, in the other category where work expectations are being deferred, but otherwise they're in the regular EIA assistance category, those would be individuals that have a short-term recovery time as they're recovering from a surgery or other a short-term ailment, and they're anticipated to be recovered in a short-term period. And again, all that is subject to that. In that particular category, that would be subject to a doctor's assessment.
The member for Point Douglas.
I'm wondering if the minister can tell us if addictions and mental health would fall under any of those categories, because we see psychosis, we see all spectrums of folks when they're, whether it's mental health breakdown and they can't work, or, they have an addiction and they might be in shelter and we're trying to get them, on EIA, and there's so many barriers to that. If they would be considered as, I guess, a newly named medical barrier to full employment program, or if, say, somebody that was, that has diabetes, whether that would fall under category 1 or category 2, or where they would fall, because we know diabetes is not something that, folks recover from, and they do have a special diet. And again, many folks are at different spectrums on with diabetes. I had a constituent who had to have the ambulance called on them because their diet was cut, and they went to the bank to take money out and they collapsed at the bank machine, and someone came in, found them, called the ambulance, they were taken. Their sugar levels were low because they weren't, they didn't have the extra funds to have a proper diet. So we see a number of cases like that. So I'm wondering if, again, mental health, addictions, and as well as diabetes, where they would fall under those categories.
The Honorable Minister of Families.
Thanks. I thank the critic for the question. And for starters, I want to confirm that all the health benefits extended to people on EIA who are now moving into the Disability Income Support Program will remain the same in terms of funds for the special diet, access to prescription drugs, the dental benefits. That will carry over for whatever category of disability benefit a person qualifies for. In regards to assessing somebody who has a particular disability, such as diabetes that the member had referenced, or people experiencing addictions and are in a long-term recovery program, or experiencing mental illness. So we are in the process of developing an assessment tool with the expert guidance of medical professionals as well as the community to create an assessment tool that will not only be allowing us to continue with a person-centered approach and really taking that to a new level where we are being able to uniquely establish an individual's needs and assess their needs and put them in the program that best suits their needs. And that is what I mean when I say a person-centered approach. But we also need to establish some baseline or continuity so that people would also have an expectation that they would, if somebody else had received a benefit based on criteria that, and they met that similar criteria, they too would receive that same level of service or that benefit category. And so this assessment tool, which, as I said, is in the process of being developed, will really help provide that person-centered approach, but also a consistent methodology as we are making assessments and eligibility, establishing eligibility for entrance into the programs.
The member for Point Douglas.
Just a point of clarification. So I understand it's a person-centered approach, but if a person has diabetes and they require a special diet and they've been removed out of any of these categories, they're no longer receiving the funds for a special diet. Should we not have another category so that those folks that perhaps might be able to work or are working part-time, supplementing their income, so that they can have the extra funds to be able to get their special diet, take care of their health and not worry about, their sugars going low, and maybe they can work but not full-time, but they still need assistance. And then the other clarification I wanted to know, the minister said that if the person was in long-term recovery programs, many folks can't get there because they're not even on EIA and there's barriers. So if a person had an addiction, they weren't in a recovery program, are they still able to access any of these three categories?
The Honourable Minister of Families.
Thank you. So in regards to the special diet, which is a benefit of range between $27 and $171 a month benefit, any individual, any client on EIA or the Disability Income Support Program, if they qualify for any category of support, they are eligible to also receive the top-up benefit for their special diet of between 27 and 171 a month for particular medical needs. And if they're having a barrier to accessing that benefit, if there's a specific constituent that the member is thinking of in posing this question, I'd be certainly more than happy to look into doing a case review or having the department do a case review to see what could be done to ensure that the person receives the benefit that they are eligible for that would prevent traumatic incidents like not receiving the food that they need to maintain appropriate blood sugar levels. So I'd be more than happy to look into that specific case for the member, but all EIA clients are eligible if they have the special requirements because of a disability like diabetes, then they would be eligible for the special diet supplement. In regards to someone who is in long-term recovery, there wouldn't be any barrier to accessing EIA in any of the categories if they were eligible to receive those benefits.
The member for Point Douglas.
So if I understand the minister correctly, someone with diabetes could apply for the special diet or $27 to $171. Just going back to the long-term recovery. So someone could be in a shelter, have addictions, still access the services, and still qualify for one of these so that they could, I just think about people needing, like one of the basic needs is housing, right? And when you're in a shelter, you're just trying to survive. And often, addictions is a survival tool, right? And to get them into a house, to get them into one of these extra support programs could be all the difference. So, but they're not in recovery yet. Would they still fall in under any of these three, even if they didn't have a psychosis? Because addiction is, a medical condition, and people do require extra supports. And yeah, to me, like someone with an addiction wouldn't be able to access full employment, especially if they're living in a shelter. They might, be on meth, like who knows, something that's brain altering where they need at least 6 months or more of treatment, but they're now not able to access that because they have no supports. Would they fall under any of those three? And I hope that's clear, kind of my question.
The Honorable Minister of Families.
Great, thank you. And I believe I will attempt to answer the question as fully as possible, and if there needs further clarification, I will seek to provide that. But when it comes to an individual living in shelter, if that shelter is providing the meals, that client may not get the special supplement for food if their meals are being provided. But if their meals are not being provided, then they should be able to get the supplement, no problem. And it is assessed on an individual basis. So that is where the individual always needs to be in contact with the director to ensure that their needs are being met and that they're receiving the benefits that they're entitled to. In regards to somebody who's in a long-term recovery program, we are still in the process of developing that assessment tool, but there again, it would be if a person who is on EIA to meet their basic needs, and they're also in a long-term recovery program, and they have spoken with they've received professional advice and guidance about the long-term disability or impairment to seeking employment, they certainly, at the director's and their professional advice from their medical professional, should be able to qualify for one of the categories in the disability income support program. I say that knowing that we are in the process of still developing that assessment tool, and that assessment tool is going to be incredibly important because I do recognize that there are a lot of individuals who have very unique needs and who will be coming forward with unique circumstances, and it's going to be a challenge, but a challenge that our department is committed to rising to ensure that we meet their needs, that we take into account the disability that they're experiencing, whether it be short-term, episodic, or long-term, and getting them the appropriate benefits.
The member for Point Douglas.
Okay, I thank the minister for that answer. I do want to hear though whether, even if somebody wasn't in a shelter and they did have an addiction, that they would be able to access these three categories, but I'll move on. Can the member or minister give us a better understanding what the medical barriers to full employment program is, and what would be different, or what is different about it from the existing disability program? So for example, can the minister explain when work expectations might be applied to those in the new medical barriers to full employment program? What changes there for the medical barriers to full employment program compared to the existing disability program?
The Honourable Minister of Families.
So under the medical barriers to full employment category, a person enrolled in that program would receive everything that they're currently getting if they are in the EIA persons with disability category, which includes the $1,109 a month benefit, as well as overlooking certain assets, and if they have a disability, income, pension, they can, we don't take into account other sources of income into their annual, when we're calculating their annual income, such as gifts from families and friends. And then we are also adding an extra $50 a month, which would allow, there's $25, which is just an increase that we provided October 1st, as well as a $25 benefit for working with them in terms of planning, preparing their case plan. It's a benefit that we use to incentivize people to come in and work with the department on individualized case plans. So that is that medical barrier benefit. The full and severe and prolonged benefit, those individuals would receive everything that's in the medical barriers category, plus $100 a month shelter benefit, and $45 benefit for laundry and telephone services. So it's another 15% increase for individuals who are in the full severe and prolonged category.
The member for Point Douglas.
Okay, I thank the minister for that answer. So the changes from the existing to the medical barriers, it's just a change in monetary. So they're getting an extra 100, or they're getting their regular benefits plus an extra $50 and a $25 incentive a month. And then the second is if they are in the full barrier, they're receiving an extra $100 on top of that. Is there any other changes to any of those from the existing disability program besides monetary?
The Honourable Minister of Families.
So people in the medical barriers to work category would have no work expectations for the duration of the time that they're in that, they're receiving that benefit. People in the severe and prolonged disability category would not only not have that work expectation, there wouldn't be the requirement for an annual assessment, as well as an earnings exemption of $12,000 per year.
The member for Point Douglas.
So just to clarify, so those folks that are in the medical barriers to full employment program, when would they be expected to return to work, or would they be expected at all?
The Honourable Minister of Families.
During our consultation, we had heard loud and clear from the community that while people are experiencing a disability, even those who have a disability, even if it's not expected to be a permanent disability, but they're dealing with it, there should not be a work expectation. So as long as an individual is in that medical barriers to full employment, they are not required to have, they don't have a work expectation. If they do express an interest in returning to work and they feel that they're ready to re-engage with the labor market, we do have community navigators in place who will help them on that journey towards independence, will help them achieve training or reach out and find opportunities that would that they would be suited for. But there is no work expectation.
The member for Point Douglas.
Okay, I thank the minister for that question. I was just talking to the member from Thompson, and he was sharing a story about someone who is a double amputee that has trouble accessing services because they've been told, well, while they've lost their limbs, their legs, that they can still type and, you know, cognitively they're there, but mentally, because of the disability, it's really set them back, and they've been told that they need to go back to work, and they've been pushing them to go back to work. So I just want clarification whether that would be an expectation. And I know the minister talked earlier about somebody maybe having cancer, going through chemotherapy. We know that, like, there's a 5-year kind of, you know, if you've been in remission for 5 years, you have a clean bell, you can. So if those types of things would play into that, and whether they would be forced to go back to work. And I hear what the minister's saying, that they wouldn't be forced back to work, but I just want to make sure and clarify that when these folks are in those types of situations, that there isn't an EI worker saying, well, you know, you're capable, you're now in remission, or you've had your last chemo, and they might still be, you know, dealing mentally with what they've gone through, that they won't be forced back to work, and that there'll be a period of time where they get some support to maybe transition slowly if they're capable.
The Honourable Minister of Families.
Thanks, and I do want to express my appreciation to the member for Thompson for raising that situation of a constituent that has undergone that experience. And if he'd like me to look into that, I certainly would. I do want to just say that this new program, it is in the process of being developed and implemented to better help meet people where they're at, and in taking that person-centered approach to that assessment, which would allow them to receive the benefits that they need. And that assessment, of course, would include mental, physical well-being. And we are certainly undergoing transformation in our EIA department and moving forward to better meet people where they're at in delivering the service. I do want to highlight 3 new initiatives that are also helping people who are in the transition phase between maybe coming off a disability or coming off of EIA and moving into the workforce, but just need some training and some supports and some connections. And one of those programs, we just made investments in Career Connections in Brandon, and then in Thompson, Fire Spirit and YWCA. Fire Spirit is specifically about helping Indigenous people with their on the road to wellness, which of course leads to the road to independence. And we also recently established a $20 million endowment fund with the Winnipeg Foundation to provide an annual fund called the Journey to Independence Fund. So we have an intake right now, or maybe it just recently closed, and it's the first of its kind, first time that we've done it, where we've asked nonprofit organizations who are offering training and services to clients on EIA who maybe they need to take a life skills training program or a modern day version of life skills. I reference life skills because that was the program that I took in 1989. And I know that there's definitely more modern programs out there, but we know that these programs are certainly life-changing for many clients, and we're wanting to see more of them being offered to everybody that would allow the client to receive training and opportunities that would be available to them. So we are looking forward to rolling out these grants to successful applicants in the near future. I haven't received an update because we did just open up the intake a few weeks back. I don't know how many applicants we received, but I'm certainly hopeful that there were several of them. And I hope that we have many organizations willing to offer training and really just meeting people where they're at and providing them with upgrades to their skills.
The member for St. James.
Thank you, Mr. Chair, and I'll just be sitting in briefly while my colleague takes a short break. Wanted to ask, according to the Minister's regulatory consultation website, there are also 2,000 people with shorter-term disability lasting less than a year who will be, quote, will be recategorized once their current eligibility period expires. That will also mean that going forward, that those whose disability is not categorized as lasting longer than a year will no longer be eligible. Can the Minister provide an explanation for that change?
The Honourable Minister of Families.
Thank you very much. And so I can confirm for the member that that number, that 2,000 number is accurate. Everybody's entitled to a full assessment, and we look forward to providing those services to all individuals that will be moved into the medical barriers to employment or the severe and prolonged disability category, or into the regular EIA program with perhaps some of the benefits that are available to them based on their needs. If they have special diet, they certainly qualify for the 27 to 171 top-up benefit for their dietary needs or any other benefit. We really are moving forward to a person-centered approach, and we'll be assessing each individual and hopefully making these assessments and putting people into the proper category based on the new criteria.
Member for St. James.
Thank you, Mr. Chair. Can the minister tell us when she expects that the 2,000 people will be recategorized?
The Honourable Minister of Families.
So again, I'd like to reiterate that we don't know how many clients won't be eligible for the medical barriers to employment category. And but what I can confirm for the members that in January, we are anticipating moving approximately 8,000 clients from the EIA category into the severe and prolonged disability category. That is based on some data that's easier to attain, such as they're already existing CLDS clients or have the requirements, as I'd spelled out in an earlier answer, about the entry into the severe and prolonged category. So we're hoping to migrate those 8,000 clients in January, and then in March and April of this year, we're hoping to take all clients who are eligible into the new medical barriers category. But again, everybody who's currently in that category is eligible for and entitled to an assessment to determine eligibility.
The member for Point Douglas.
Which I thank the minister for that answer, and it's nice to see that 8,000 people will be supported. I just want to go back to the amount of people, and I know you're not looking at that right now, if you would take that under advisement to let us know when or how many people are expected to be taken off of any disability supports in the future, and if there's going to be a transition, what that's going to look like, because I told you about diabetes, right, and people being taken off that even though they have letters. So that's one thing. And then I just wanted to go back to the question that I asked earlier. The minister referenced a training program, Journey to Independence. The nonprofits were taking up that work and that they were to apply for grants. I'm just wondering if the folks that are going to be in that training whether it'll be paid training or they're just going to be receiving their regular benefits while they're going through that.
The Honourable Minister of Families.
So next year, at the very latest, in the annual report will be the numbers of all the participants in the severe and prolonged disability category, the medical barriers to employment category, and the regular EIA category. So those numbers will be reported in our annual report. At the very latest, it'll be available next year at this time. In regards to the benefits available to people, I should clarify that the Journey to Independence program, we haven't assessed the applicants yet, so we don't know what we're gonna receive in terms of proposals from community organizations. But quite often these proposals do come with a wage subsidy, and I look forward to learning about the initiatives and then awarding some of these initiatives to the community for eligible applicants. But every EIA client who is undergoing training, they receive access to child care, a top-up benefit for their transportation, bus pass, or other transportation costs, as well as just a $25 miscellaneous benefit for the costs associated with attending a training session all day. Sometimes they might need to spend a little bit more on food, because they're obviously not going to be at home. They're going to be at a place of work or a training center for the day, and those costs might be additional to what they would normally experience. So the $25 miscellaneous benefit is automatically awarded to anybody participating in a training program.
The member for Point Douglas.
Miigwech, thank the minister for that question. I hope that they would take under advisement that these are people who are going into work and that we should be paying people to go into paid labor. I realize that, they're going to gain skills. These nonprofits are going to be getting grants to support them. I do recognize that as well. So I'm not sure if they're just going and sitting in a classroom all day and that's the purpose, or whether it's on-the-job training. But if it's on-the-job training, I think that we should be providing incentive closer to a wage so that people can actually see what it's like to make money above EIA. It certainly gives people incentive to be like, making $1,000 a month versus 20, maybe 2,000, or, over 2,000 a month is certainly incentive, and having people experience that. But I'll move on. On September 10th, 2021, Accessibility Advisory Council released its 5-year review of accessibility standard for customer service. It provided 22 recommendations. Can the minister tell us whether she accepts in full all of these recommendations?
The Honorable Minister of Families.
Thank you very much. So I can confirm that we received 22 recommendations. 21 of those recommendations have been accepted and are being implemented. The one recommendation is still being further researched, and that was the recommendation to go to down to 25 workplaces with 25 employees or greater must publish their accessibility plan on a public-facing platform. Right now, the standard requires businesses with 50 or more employees to publish their accessibility plan on a public platform, and the recommendation is to go to 25. So we're doing a little bit of research right now as to whether or not that would improve compliance or not. And right now, with having workplaces of 50 employees or greater needing to publish their accessibility plans on the public platform is very consistent with other jurisdictions, including Ontario. I do want to also reiterate that regardless of whether or not you have your accessibility plan published on your website or available to the public for perusal, it is still the law, and you still must be compliant with the accessibility standards. So even if you just have one employee, you still have to comply with the Accessibility for Manitobans Act, and you just don't have to have it in a public domain.
The member for Point Douglas.
So just to clarify, 21 of the recommendations, the full recommendations were accepted. Just want to clarify that. And then just to move on, can the minister tell us what the time frame is to implement the 21 recommendations that they are fully implementing?
The Honorable Minister of Families.
So we'd received these recommendations last October, and we committed to implementing within 2 years. So we have an expectation that within a year from now, we will implement all the 21 recommendations that have been accepted. And I can confirm that we are just about to publish our annual report on the implementation of those recommendations. That report will be available this month, and as soon as it is, I will endeavor to provide the members opposite a copy of it. But yeah, we are committed to fulfilling those, implementing those recommendations within the next 12 months.
Member for Point Douglas.
Okay, I thank the minister for that answer. I'd like to read from the review. So one of the overarching themes council heard throughout the consultation process was a lack of perceived leadership and accountability shown by the provincial government in implementing the accessibility standards for customer service participants. They expressed that as the Manitoba government provides services to all Manitobans, it must do a better job of leading by example. As stated at the time of the 4-year independent review of the AMA, the government did not assign additional staff nor fiscal resources to implement the legislation. The direction given to the Disabilities Issues Office, now the Manitoba Accessibility Office, was to implement the law in a cost-neutral manner. Within the last 8 years, the MAO's budget has only received a modest increase. Can the minister explain and respond to this concern?
The Honourable Minister of Families.
Thank you. I can advise the member that we have established an accessibility steering committee that will help guide the work of government to ensure that we do play a leadership role in the implementation of our accessibility standards and on all matters pertaining to accessibility. So that is new since the publishing of the report that the member had referenced. Also new is the the creation of 4 new FTEs. We have, and the creation of a new compliance secretariat that has been moved out of the Manitoba Accessibility Office and is a standalone secretariat. There's 2 new FTEs in that secretariat, and work is underway to increase the capacity of the secretariat as new standards are being implemented and passed. And then the other 2 new FTEs are in the Manitoba Accessibility Office. And that is mainly to provide support and also to administer the new Manitoba Accessibility Fund. A year and a half ago, we established the $20 million Manitoba Accessibility Fund endowment, and every year we have just a little bit shy of $1 million in funds to provide to the community for compliance with the accessibility standards. This is in response to a lot of concern that we'd heard from whether it be AMM, municipalities, organizations, and businesses who were saying that they were needing to have funds to increase their capacity and to comply ultimately with the standards. And so this Manitoba Accessibility Fund was created to provide that source of revenue for all these businesses, organizations, and municipalities that need to comply, and ensuring that those dollars are being put towards good projects, and that applicants are being assessed as applications come in. We hired 2 new FTEs in the Manitoba Accessibility Office. That's all new work that has taken place since the report was published that the member is citing.
The member for Point Douglas.
The minister for that answer. The member from Maples had raised a concern when we were talking about accessibility. The member had shared with us that cab drivers have to take accessibility training, but ride-sharing groups don't have to. Can the minister speak to that, and whether that is something that's going to be an expectation in the near future, as they are doing the same kind of work?
The Honourable Minister of Families.
Thanks. I appreciate the member raising this, and they're correct in that ride-sharing services were not conceived of when the AMA was first passed into law, and so we are having the Compliance Secretariat look into ways in which we can ensure that ride-sharing organizations can be taking appropriate accessibility training and meeting their obligations under the AMA.
Member for Point Douglas.
Can the first of all, we're going to go on to something else, just some generic questions. So we're not going to get to CFS because it was a lot to delve into, and the member from Thompson had to leave, and we didn't think that we would get through all these disability and accessibility questions. So I don't know if those folks want to, I'm sorry about keeping you. So can the minister tell us who her political staff are?
The Honourable Minister of Families.
Thanks. I'm very pleased to have Melanie Mahar work in my office as a special assistant, and she is somebody who's got tremendous experience and knowledge, and is just an overwhelming asset to the Minister of Families and the entire office. And new to my office and joining us here today as well is my new executive assistant, Cosette Baudin, who has been on the job for 10 days, I believe, and is a tremendous asset, and is very, her contributions to the office are greatly appreciated, and I'm very pleased to be working with both of these brilliant assistants.
The member for Point Douglas.
Can the minister tell me the vacancy rate for the department as a whole?
The Honorable Minister of Families.
Thank you. There are 2,015 FTEs in the Department of Families, excluding the FTEs assigned to the Manitoba Developmental Center. There are 328 vacancies, which translate to a 16.1%.
The member for Point Douglas.
Miigwech, can the minister provide me the vacancy rate by division of her department?
The Honorable Member of, or Minister of Families, sorry.
Sure, I would like to ask the opportunity to bring that information back. We need a little bit of time, a few days, to put that information together.
The member for Point Douglas.
Miigwech, I appreciate the minister taking that under advisement, and we look forward to getting that information as soon as possible. In its 2021 annual report, the Social Services Appeal Board identified concerns for EIA recipients in getting access to outpatient physiotherapy after surgery. What steps, if any, is the minister taking to address these concerns?
The Honorable Minister of Families.
My department is currently consulting with the Department of Health to look at future opportunities and options.
The member for Point Douglas.
Can the minister tell us how long that review is going to take before people start to be able to have access to physiotherapy after surgery? It's really important for people, especially in their recovery, to be able to have access to that. So I'm hoping it'll be done in a timely manner, because we have quite a few people that are having surgery these days and, you know, need access to that. So how long is that going to take?
The Honorable Minister of Families.
So we are in the very early stages of researching ways in which we can expand the programs for people to access physiotherapy programs. I can say that we are looking at the success of a chiropractic model that we've implemented where we do have where people on EIA may receive additional chiropractic benefits, as well as having a special chiropractic clinic that we've established and funded at the Mount Carmel Clinic, which is ultimately removing barriers to access for individuals in the community to receive. And so we're looking at the success of this program and looking at ways in which we can expand service delivery.
The member for Point Douglas.
Okay, I appreciate folks being able to access chiropractic, at Mount Carmel Clinic, but the question was about outpatient physiotherapy after surgery and how long it's going to take for that consultation, because people are, waiting in pain, or this is perhaps limiting, their accessibility to get out or their recovery. So it's specific to physiotherapy outpatient after surgery.
The Honorable Minister of Families.
We are in the early stages and I don't have a timeline.
The member for Point Douglas.
Okay, I'm hoping that it's not going to take too long because again, it's helps with people's recovery. Our team has heard from someone on EIA who has been denied coverage for hormones, so progesterone and injection estrogen. Is the minister aware of a policy or other changes in this area that would result in a loss of benefits?
The Honorable Minister of Families.
So I can confirm that we follow the formulary established under the Pharmacare program under the health department. And doctors can also apply for exceptional drug status if someone needs access to a drug that is not on the formulary, and yet an assessment has confirmed that that drug is needed. I can't speak specifically or list off what drugs are on the formulary, but if the member has a constituent with a specific case that they would like me to review, I'd certainly be willing to undertake that.
The member for Point Douglas.
Okay, I appreciate the minister's offer, and again, it's specific to progesterone and injection estrogen, which I'm assuming probably isn't on the formulary. And so if a doctor were to write a letter to an EIA recipient requesting that approved.
The Honourable Minister of Families.
Department of Families does not employ the expertise required to make a medical assessment or determination of that sort. Doctors are certainly familiar with the exceptional drug program, and that the EIA client would be subject to a medical assessment, and if the doctor had applied for exceptional drug status, there would be no barriers for receiving those treatments.
The member for Point Douglas.
I thank the minister for that answer, and I do hope that that would be taken under advisement as more and more folks are trying to access these drugs, when they're transitioning, and certainly it's something that they need to be able to do that. The Manitoba Development Center is slated to close in 2024. Can the minister provide an update on the plan to close that facility and the transition plans for staff at that facility?
The Honourable Minister of Families.
So currently MDC has 102 residents remaining, and work is underway with an individualized care plan for each of those 102 residents. There are 7 agencies that are actively engaged in establishing new community residents for some of these clients to transition into, and we're looking at building capacity amongst other agencies that are already established in community. In regards to the workforce, we do have a workforce adjustment team that has been created to strategize recruitment, retention options, and to really ensure that the employee impacts are reduced. We're working diligently with Shared Health in particular in the region, finding options for each of the employees at MDC.
The member for Point Douglas.
There are currently 359 positions remaining at MDC. How many of these positions does the minister anticipate?
Order. The hour being 5 p.m. Committee rise.